Have you ever witnessed a loved one suffer? My family and I experienced this. We all knew my grandmother would be much happier not in distress. It is hard to watch someone to be in so much pain that you care so much for. Did you know the word euthanasia came from the Greeks meaning good death? I would like to inform you on why euthanasia and assisted suicide should be legal. With the legalization of euthanasia and assisted suicide, the patient has the choice to take away their suffering in a supervised environment by a professional. Both of these choices aid the sufferer in choosing a death with dignity and relief from constant agony. To begin with, the difference between euthanasia and physician-assisted suicide is that euthanasia is injected directly by a doctor. On the other hand, assisted suicide is where the doctor assists the patient by prescribing a pill to end their life, which they can take whenever they want. Although they are different forms, they both aid the patient in having a death with dignity and relief from constant pain. The patient should also have a personal choice. Patients should be able to control their dying process, just like if they have the right to refuse treatment, they should have the choice to end their miseries. The legislation violates the freedom by not passing this law for people to choose their death. Legislation also needs to discuss this matter openly due to the many illegal practices of euthanasia and assisted suicide. The Oregon Dignity Act that was established in 1977 gives terminally ill patients the choice to end their life in a pill form. With this choice, the patients can choose the time and location of their death. People make their own choices every day, and they should have the same option when it comes to them dying. The misconception that euthanasia and assisted suicide is the shortening of one life is not ethical. In reality, the patient is dying anyways. With these ways, it relieves the pain. In addition, many financial struggles come along with these incurable diseases and constant care. This becomes a financial burden, especially if they do not have insurance. Bills continuously add up that they cannot afford. For example, hospice care is very expensive with a person living with a decreased quality of life. With these choices, they will no longer have to worry about the constant cost of medical bills. A person with an incurable disease finds it very difficult and hard to pay for medical bills when they know there is no cure for them. This gives the patient and the patient's family financial freedom. Also, it will help the hospitals. The hospitals will be able to serve more patients. A person with an incurable disease takes much time away from the doctors and nurses. According to Andrew Walter, who wrote, "Point, euthanasia should be legal. These doctors and nurses will be able to help more people. More hospital beds and resources will be available. This will also help cut expenses for the hospital." With the choice of euthanasia and assisted suicide, they both provide a supervised and comfortable death. According to Life Wisconsin Right to Life, Washington v. Glucksberg, Gonzalez v. Oregon, Vaco v. Quilt, and Carter v. Canada are all cases tried in the court system based on this issue. The Supreme Court of the United States has heard some of these cases. This shows how important this matter is to some people. According to Catherine Tucker, who wrote, "People should be allowed to choose doctor-assisted suicide. Some people are so determined to end their pain, they do it regardless, no matter the terms. These options should be legal to avoid a harsh and painful death. Instead of ending their life on their own terms, they will be allowed to end their life surrounded by family members in a humane setting. The patient has to be competent, terminally ill, or deathly that cannot be cured for these to be administered. Both of these are legal in other countries like Belgium, the Netherlands, and more. The poor class is getting their freedom stripped away from them. The upper class can afford to travel to these countries to get euthanized, which also gives money to the other countries instead of our own. Caregiver guilt is also a main issue due to the emotional attachment to the deathly patient. Knowing that it was the patient's decision gives them an ease at heart. Euthanasia and physician-assisted suicide should be legal for many reasons, as you can see. These options make death more easy for everyone involved, but most importantly, the person ill. They will help the patient be cured from intolerable pain, the financial struggles, and they will also have a personal choice in their supervised death. I gained this knowledge by doing an extensive research on the Alabama Virtual Library website.